my name is Christine Green, and this will be a respiratory assessment. First, I would walk in and provide privacy to the patient, introduce myself. Hi, my name is Christine. I'll be your nurse today. Can you give me your name and your date of birth?
Alfred Schunrich. Date of birth is 7/7/50.
Okay, so I would check that. I would explain to the patient that I'll be doing a respiratory assessment today. First, I would ask if there's been any pain recently.
No.
Okay. What I'm going to be doing too is doing his vital signs. If he did say he had pain, I would do a full pain assessment and use the acronym OLD-CART, which is to find out like where the pain originated, where it's located, how long he's had it, does anything make it better or worse. And then I would do the vital signs, perform the vital signs, which is blood pressure, which the normal range would be anywhere from 90/60 to 120/80. O2 sat is anywhere in the 90s to 100, the average. Breath is 12 to 20 breaths. Body temp, I would also do 97 to 99 is the average. And heart rate 60 to 100 beats per minute. Then I would start the and BMI would be adequate. I will also document that as well. So then I would first do the assessment. I would inspect. He would have his shirt off for this part. So I would inspect just the skin and, know any like lesions or anything like that, or cuts or bruising. I would also, before that too, ask if he's, are you a smoker?
No.
Okay. Any history of, anyone in your family have any like respiratory issues or okay. And so I would go through the skin inspection just to see if there's any like lesions or cuts or abrasions or anything like that. I would look for symmetry. I would also have him looking for the anterior and posterior just to see if there is any like he has like a barrel chest, which would indicate like COPD. I then would also look at his nail beds because he's just a darker shade. I would indicate like any like bluish or cyanosis, anything around his mouth area, the mucosa, the nail beds. I would look at the bottom of his fingers, palm of his hand, just to see if there's any indication of any respiratory distress. Like I said, shape and symmetry of his anterior and posterior. And then note any like cough or sputum or anything like that if he's had any recent cold or flu-like symptoms. Then I would look, I would go to his back, and so I would have him just bend forward a little bit and cross your arms like so. And so I would, like I said, the shirt would be off, and so I would make my hands like a W, and I would have him take a deep breath in, and as I'm doing that, my thumbs should touch as he's taking a bit deep breath, and that would help with indicating any symmetry. Noting that he has it's symmetrical. Then I would make sure I take the alcohol swab and swab my stethoscope like so. And I would, so I'm going to be listening to some breath sounds. So I'm going to start anteriorly. Is it off?
That's fine.
Okay. So I would start with the anterior, and I know you're not taking it for sure. So first, I would start with at the cervical, above the cervical, of the clavicle, sorry, and I would have to take a deep breath in and out, and then the opposite side. And then I would work my way down. And for the purpose of this video, I won't have him do the breath sounds, but I would do a ladder approach on each side, like so, and all the way down. And then posteriorly, I would do the same thing. So what I would do is have him lean forward. And so I would do the same thing. I would start at the apex and do a ladder approach as well, indicating I wouldn't, making sure that I would have him lean forward again with arms crossed, so that way I can separate the scapula, because you can't hear breath sounds over the scapula, and also do the ladder approach again on each side. And also the lower lumbar I would do under the axillary, making sure I check both sides of that as well. I would document after that any all the information. Okay, I will let you. That completes the respiratory assessment, and I will let the doctor come in. That'll be it.
All right.